So I'm hitting record and you can go ahead and get started. Gabby, you're first with Zoe as the patient.
All right. Hi, I'm Gabby. I'm a registered dietitian. Nice to meet you.
Hi, Gabby. Nice to meet you too.
Thanks for coming in today. Welcome to my Zoom room.
Thank you.
You prefer to go by Miss Paxos or something else?
Zoe's fine.
Gotcha. And did I say your last name right?
Yeah, that's correct.
Okay. So Zoe. All right. And I use she, her pronouns. What pronouns do you usually use?
She, her.
Perfect. Thanks for letting me know. So how are you doing today?
I'm doing pretty well. Just a little tired.
Hanging in there though?
Yeah.
So I understand that you recently saw your doctor for a diabetes follow-up. What brings you in here today?
So my doctor actually told me to come in here to you for a follow-up to make some more changes to my diet.
So you want to specifically focus on your diet?
Yeah.
Okay. And that's your main goal?
Yeah. I mean,
Okay.
I wouldn't mind fixing my diet hopefully will help me lose weight and manage my blood sugars and, help me feel better.
Okay, so diet for blood sugar management. Have you ever made attempts to make changes to your diet in the past?
Yeah, I've been doing a lot better. I've learned to cut back on going out for fast food. I used to do that every day, but now I cut it back to twice per week, which actually helped me lose a lot of weight. And I also started exercising more.
That's great to hear. So it seems clear to me that you're committed to acting on your goals and you're making these changes to better your health. So then maybe we can build off of that today in our session.
Yeah, it sounds good.
Awesome. And so did you make these changes after meeting with a dietitian?
Yeah, that's actually what helped me make these changes to begin with. I saw a certified diabetes educator, registered dietitian about 3 months ago, and she helped me make these changes.
Sounds good. So then for today, then we can focus on just learning a bit more about you. I'll just learn about your daily life, some of your medical history, and then we'll narrow in on the diet and the exercise habits since that's a goal of yours. How does that sound?
Sounds good.
Great. So I know everyone hates this question, but can you tell me a little bit about yourself?
Yeah, so I live with my husband and my 14-year-old son, and I work as a construction manager. It's a very busy job. I work from 9 to 5, Monday through Friday. So it's a lot of work, but I do love my job.
Great. I was going to say that sounds very busy between the family life, your full-time job.
Yeah, it definitely gets hectic and sometimes it's hard to focus on myself.
For sure. That's understandable. But I'm glad that you said you're already making some changes, so you're finding places to fit them in that busy schedule.
Yeah, definitely.
Okay, well, thanks for sharing a bit of your daily life with me. I just have a couple questions just to verify some of the information in your chart is correct. How does that sound?
Sounds good to me.
Okay, so I see the following diagnoses: hypertension, hyperlipidemia, high cholesterol, type 2 diabetes, and sleep apnea. Are those all correct?
Yes.
Gotcha. Is there anything missing from that list?
No, I don't think so. I think you covered it all.
Perfect. Have you had any new problems since your last visit?
No new problems. Things have actually gotten better from last time.
Great. I'm glad to hear that. I see prior to meeting with the CDE, you had some fatigue, some persistent hunger, some hypoglycemic episodes. Can you walk me through how those symptoms have been recently?
I've still been feeling a little bit times, but I've definitely been a lot less fatigued and hungry since my last visit. So things have gotten much better.
Great. So we're kind of on the upswing. We're moving in the right direction.
Yeah, definitely.
Good, I'm glad. All right, so thanks for updating me on some of the medical stuff. Now we can dive into the nutrition specific stuff. To start with, do you have any food allergies or intolerances?
Nope.
Nope, okay. And do you mind walking me through a typical day of eating, starting with the first thing that you would eat?
Yeah, so normally for breakfast, I usually have oatmeal and 2 hard-boiled eggs and coffee, usually black with Splenda. And then for lunch, I usually have a turkey and cheese sandwich on wheat bread and veggie straws, an apple, and Diet Coke. And then after that, I usually have an afternoon snack like light Greek yogurt. And then for dinner, I usually try to have a lean protein like chicken or fish, and then vegetables, salad, a baked potato, and then some more Coke. And then that's generally pretty much it for a typical day.
Gotcha. Okay, so it seems like you're hitting all those major meals. You have some snacks, and that snack was that before dinner snack?
Yeah.
Okay, okay. Anything in the evenings?
Um, well, sometimes I tend to snack on chips or popcorn after dinner. Sometimes I get a little carried away, like when I'm watching TV.
Gotcha. That can be tough. I find myself doing similar things. It can be hard to disconnect from the media, but
Right.
yeah. And then where do you find that you eat most of your meals? I know you said you work full time.
Yeah. So actually, lunch is usually the biggest meal because they're just like a really convenient um, sandwich shop nearby that I can eat at, and I usually eat really fast and I eat a lot because I'm stressed that I won't have enough time throughout the rest of the day.
Mhm.
But then sometimes I do like to pack my own lunch, and then that makes like my lunch healthier. But then, like I said, like I tend to snack a lot at night.
Mhm. Okay, so falls within the workday, and depending on the day, you might have packed, or you might venture out to the sandwich shop and eat something there.
Yeah.
Gotcha. And then the other meals you're eating at home, I assume?
Yeah, breakfast I eat at home before work, and then dinner after work. The afternoon snack is I usually bring that to work.
Gotcha. Okay. Thanks for sharing that. And then if we can switch gears a bit, what does your typical exercise routine look like?
Um, I really like to walk and lift some weights. Um, Usually 30 minutes a day of walking.
Gotcha. And how many days a week would you say that happens?
I like to shoot for 5 days a week, but lately I've been only able to do 3.
All right. So you like to walk, you like to lift weights. The walks are typically 30 minutes, right?
Right.
Okay. All right. So thanks for sharing that information with me. I think that's a great place to start. And then maybe we can move into thinking of some changes you can make if you're open to that.
Yeah, definitely.
Awesome. Thanks.
Guys can get started.
Hi, good afternoon. My name is Marwa, and I'm going to be your dietitian today.
Hi, Marwa.
Hi. It's really nice to meet you. Today, we're just going to have a conversation about your day-to-day diet, and I'm going to get to know you a little bit. Does that sound okay?
Yeah.
Okay. And would you mind just confirming your name and date of birth for me, please?
My name is Daisy Liu, and my birthday is January 12th, 1975.
Thank you. And how would you like to be addressed? Is it okay if I call you Daisy, or do you prefer Miss Liu?
Daisy is fine.
Okay, Daisy. So, how do you think we can best use our time together?
I'm not really sure what to expect out of this. I was just referred here after I had an appointment with this new neurologist, and I think they wanted me to come here to kind of learn more about a diet. And I had mentioned a supplement I wanted to start taking. So I think they just wanted me to get more information from you.
Okay. Thank you for sharing that with me. And I'm happy to be here with you and answer any questions that you may have. Um, so let's just get started. The first thing I would like to know is, how are you feeling today?
I'm feeling all right. I've been having some issues. I've become more clumsy over time. I was diagnosed with rheumatoid arthritis a couple years ago, so I've just been having some more issues with that.
I see. And in your chart, I read a referral from your doctor, Blumenthal, I believe, that you've, like what you said, you've been feeling kind of slow and sluggish lately. So what's been going on?
My joints are getting stiffer. Whenever I'm walking around, I'll accidentally trip on things. I'm getting kind of shaky.
Mhm.
Those are kind of the new things that I'm experiencing.
I see. And you did just mention your diagnosis of rheumatoid arthritis. So how have you been handling that in general these past few years?
It's been kind of hard on me after I was diagnosed. I actually went back to my doctor and they diagnosed me with depression as well. So it's just been quite an adjustment for me.
I see. And then when you say you've been incredibly clumsy lately, and you describe that as being new, like what has that looked like recently? Are you falling, or talk to me about that?
Yeah, I'm just tripping on things easier. I'll kind of stumble. I just don't really feel as stable as I used to mostly.
Mhm. And would you mind just talking briefly a little bit about your depression and how you've been handling that these past few years?
Yeah, I've just kind of gotten progressively sad. Like it kind of isolated me once I found out that diagnosis. And I'm a stay-at-home mom, so I don't go to work during the day, so I'm alone a lot. But they put me on a depression medication. It's paroxetine, I think that's what it's called. And that's been helping out a lot.
Okay, well, I'm really glad to hear that that's the case. And then you say you're a stay-at-home mom, so if you don't mind, I would love to know more about like your current family status. If you could tell me more about that.
Yeah, I'm married. Me and my husband have been married for quite a few years now, and we have 3 kids. I have 2 sons. They're 13 and 7, and then I also have a daughter that's 11. And yeah, I'm a stay-at-home mom, so I just do a lot of chores around the house all day.
I mean, well, having, you had 3 kids, that does sound like a lot of fun. And it seems that at their ages, they're probably all in school. So do things at home ever get stressful or overwhelming?
Um, a little bit, but not too much.
Okay, well, that's good then. Um, so let's move on a little bit. Let's talk about exercise. How physically active are you?
I used to be very physically active. I love to play tennis and I also walked pretty much every day. But now that I'm kind of experiencing these symptoms of clumsiness and such, I haven't been doing that as much just because I'm scared. And I also recently had a fall when I was exercising. So I'm kind of scared to get back into that.
I totally understand that. How has that been making you feel lately? Because you're unable to exercise like how you used to.
Yeah, that's definitely putting a damper on my mental health, especially because, like I said, I'm at home a lot. So I used exercise as an outlet, and I don't really have that as much now.
I see. Do you think that's affecting your appetite at all? Like, how is your appetite in general?
I still think my appetite is pretty good. I haven't really noticed a change.
Okay, well, that's good. Would you mind walking me through a typical day of eating for you?
Sure. So I at times I try to follow kind of an anti-inflammatory type of diet. So for breakfast, I'll just eat some oats, and I also sometimes like to eat turkey bacon, and I'll normally have a piece of fruit with my breakfast as well. Then for lunch, I like to eat a salad with a bunch of veggies and chicken. And then I also have been focusing on eating fish. So for dinner, a lot of the time I'll eat fish, like either salmon or tuna, with some type of carb like brown rice and some veggies as well. I really like broccoli. And then I normally find myself getting hungry in the middle of the day. So I'll have a snack of like maybe some type of nut or carrots. I like carrots as well.
Good. That sounds good. Any problems with chewing or swallowing?
No.
Okay, that's good. Do you have like a favorite thing to eat for any of those meals? Any like real preferences? Dessert, snacks?
No, not really. Just like I mentioned, I've been trying to focus on fish and I really like salmon.
It's good. Do you like with your family, do you guys go out to restaurants? And if you do, like, do you have a favorite that you all like?
Um, we don't really go out to eat that much just because we have such a busy schedule, so we more focus on cooking at home.
Okay, I see. How do you feel about your current diet? Is there like anything you would like to change or address while we're still here together?
I don't think so. I'm pretty happy with my diet at the moment.
Okay, that's good to hear. And it sounds like you are aware of, like you mentioned, fish and an anti-inflammatory diet. Like it sounds like you are really aware of things that you should be doing, like to help um, with a healthy, balanced diet. So that sounds great. Um, well, I hope that we can continue to work together and that I can help you with some of your current issues and any of your concerns further. Does that sound good to you?
Yeah,
Okay, awesome. Well, that'll bring us to the end of our conversation for today. Do you have any questions?
I don't think so.
Okay, well, it was great meeting with you and thank you for your time. I look forward to the next meeting.
Thank you.
Thanks.
All right, you can go ahead and get started.
Hi, Miss Giannopoulos. How are you doing today?
I'm good. How are you?
Doing well, thank you. Welcome to our little room here. My name is Sarah, and I'm going to be your dietitian today. Just want you to verify your patient information for me, just your name, date of birth, if you could.
Delia Giannopoulos. I was born April 15, 2004.
Perfect. All right. And would you like me to call you Miss Giannopoulos, or would you prefer Delia?
Delia is good.
Awesome.
Thank you.
Yeah, not a problem. So your MD, your doctor, referred you and your parents to me to talk about possible gastric surgery. Okay. I just want to know what your feelings are about that before we get started.
I mean, it's something that's been in the back of my mind for a while because I've tried other ways of losing weight and it just hasn't really stuck. So we're kind of desperate, my parents and I, at this point, and we really are looking into this.
Yeah, absolutely. You said you've tried losing weight before. Could you explain that to me a little bit? What you did, how long? Just a little bit.
Yeah. I was in this physician supervised organization one day with my endocrinologist, and they pretty much just, helped me lose some weight. I lost 20 pounds actually, but I wasn't really able to keep it off. I ended up gaining like a lot more weight after it. I ended up gaining about 45 pounds after losing the 20 pounds. Just nothing has really worked.
Okay, so if I'm hearing you correctly, you came to see me today just to finally get this weight off and get a little bit healthier. It seems like you've tried other methods before and they might have not worked as well for you. Do you want to discuss maybe any of those barriers? I see you have type 2 diabetes, PCOS. Do you think any of those medical problems could possibly be a barrier?
Yeah, I definitely think so because I was looking it up online and was saying how PCOS actually makes it very hard to lose weight. So sometimes I feel like it's not all my fault. I know that, you know, but I just eat whatever my parents have in their house. So, and then I have a disease that makes me gain weight. So I think it definitely plays a role in there.
Yeah, absolutely. It can be hard when we're trying to make a change, and it's, you do live with your parents and they're here with us today, and it can be difficult sometimes. Can you tell me a little bit more about your eating habits?
Since I've been eating pretty much the same type of food since I was little. The mac and cheeses, anything my parents buy, candy. We're big sweets people in the house, so I love sweets. And yeah, anything that's quick because after school I don't really like waiting for my parents to cook. I just grab whatever they have.
Yeah, I definitely get that. Being at school for 8 hours is, you're definitely hungry when you get home. So can you tell me, I know you live with your parents, but do you have any siblings?
No, it's just the three of us, and we're a big Greek family, so we do see other family members and do family gatherings a lot.
That's great. What about your work environment? Do you work, or are you just doing school right now? Tell me a little bit about that.
I'm just a full-time student.
Great. Okay. Um, and maybe tell me a little bit about your family, your friends, how that kind of fits into your life.
I don't really have a social life right now because I feel like I can't keep up with my friends. They're all in sports and they're all in these things that I just like can't do because it is hard to, you know, do any physical activity for a long time. And I have like breathing issues sometimes. So I don't really have much of a social life. It's kind of just me and my parents and my family.
Okay, so you feel like it's a little bit harder to maybe fit in right now with
Yeah.
what's currently going on with you. Okay. All right. So I know we talked briefly about your PCOS, and maybe your type 2 diabetes, but do you want to give me a little bit more detail about your medical history? I read it over in your chart, but I just want to hear from you a little bit.
Yeah, so the doctors say I have type 2 diabetes, I have high blood pressure, and something about my cholesterol being high. I have really bad acne from the PCOS, and then my liver is not great. Also, they're saying it's fatty liver disease, and I have breathing issues when I'm sleeping, so I use this CPAP machine to help me breathe at night or help me stop to not breathe at night.
Okay, and are you wearing the CPAP every night?
Not really. It's just a hassle and it makes me feel so, claustrophobic. So I don't use it as much as I'm supposed to be honest.
Yeah, I understand that they can be very hard to get used to. I just want to go over briefly again your medications as well. I see you're on metformin, Yaz for, your PCOS potentially. How are those working for you?
With the metformin, I think it's going okay because my blood glucose I think has been all right. I don't really know if the other ones have affected me or not, so I'm not really sure.
Okay. And do you take any supplements, any multivitamins, anything like that?
I was taking I usually take B12
Okay.
with my breakfast or before breakfast. That's kind of the only vitamin I take.
Any reason for that?
I think they're saying it might be because of the PCOS too.
Okay.
And the diabetes, they say that the medication that I'm taking, one of them makes B12 not be that absorbable, so I have to take it by mouth.
Okay, understand. All right, and do you use any tobacco products, smoke cigarettes, anything like that?
No.
How about alcohol?
No.
No, okay. Do you have any food or food allergies or intolerances?
No.
Okay. How's your appetite? I know we talked a little bit about being hungry after school and things like that, but how do you feel your appetite is throughout the day?
I'd say it's good. I'm usually hungry all the time,
Mm,
So I'd say I have a pretty good appetite.
okay. Um, all right. And do you buy or prepare any of your food, or is it mostly your parents?
Yeah, my mom usually does the cooking in the house.
Okay. All right. And what about timing and environment? So where where do you typically eat your meals? Maybe let's talk about dinner since you're probably mostly home for that time.
Mhm.
School is not really a factor. So let's talk about dinner. Do you guys all eat at a table?
Yeah, like I was saying, we're a big Greek family, so we really do enjoy, big family dinners, sitting together. So yeah, we eat at the table usually.
Okay. Um, and we did talk a little bit about what you eat already, so I got that. What about physical activity? Are you moving throughout the day?
No, right now, like I said, I have some difficulties breathing when I'm moving around too much, so I just try not to.
Okay. All right. Um, have you had any past nutrition education at all?
Yeah, like I said, I was in that program where they for like about a year, so I learned a few things about nutrition, and I lost weight there too. It's just hard to actually keep those habits.
Awesome. All right, I understand that. Okay, so um, I got a lot of good information from you today. It seems like this gastric surgery could be in your future. I think you're a good candidate for it, and we can discuss further as we see fit. All right, any questions for me?
No.
All right, thank you so much for coming in today, and I really appreciate our conversation today.
Thank you.
Yeah, thank you.
The recording has resumed and you can go ahead.
Okay. Hello, Miss Lambertson. How are you doing today?
I'm doing well, thank you.
My name is Mason, and I'm the registered dietitian here at the clinic. I'm going to be talking to you today just a little bit about your diet or any other concerns you may have. So before we begin, can you please state your full name and your birthday for me?
Sure, my name's Maria Lambertson, and my birthday is January 17th, 1984.
Great, thank you. Now, would you like to be addressed as Miss Lambertson, or is there another name you'd prefer?
You can call me Maria.
Okay, great. Thank you, Maria. One last thing before we get into the material, what are the preferred pronouns that you use?
I use she, her.
Okay, great. I use she, her pronouns as well. So I reviewed your chart a little bit before you arrived today, just looking over some of the main parts. It looks like you recently had a gynecology appointment where you had some lab tests done, and then they referred you here to speak with me. Is that correct?
Mm-hmm.
Okay, great. So just for a little overview of what to expect, I'm just going to take about 10 minutes to ask you some questions about your diet, just overall nutrition and your past medical history. Does that all sound okay to you?
Yep, sounds good.
Okay, great. Before we get started, do you have any questions?
Not really. I'm hoping we can find some way to help me. I just feel really tired a lot of the time. That's my
Okay.
main thing.
Yeah, definitely. We'll talk about that a little bit. So if you have any questions, just feel free to jump in at any time and stop me. So kind of in your own words, can you start by telling me what brings you in today?
Yeah, so I feel abnormally tired most of the time, and it's been going on for like 6 months. I did have anemia, but my doctors say that that's resolved itself. So I'm kind of wondering why I still have this fatigue going on.
Mhm.
And that's kind of the main thing. I was on iron for the anemia, and I've been good with that regimen. So I'm kind of looking for answers now.
Okay, great. That's helpful. Thank you.
Mhm.
So I'd like to move into some questions that'll kind of give me a better sense of you as a whole. Is it all right with you if I take a few notes while we go through these questions?
Sure.
Okay, great. Can you start by telling me a little bit about your living environment, including where you live and who you live with?
Mhm. So I live with my husband. It's just us now. We have 4 kids, but they're grown and they've left the house.
Okay, great. Thank you.
Mhm.
And then tell me a little bit about your occupation, like where you work and what do you do at your job?
Mhm. I work at the middle school near me, and it's like an administrative position, so I'm in the office. And I've been doing that for like 10 years.
Oh, wow. Okay. That sounds great. Do you enjoy your job?
Yeah, I like it.
Okay, good. Now let's move on a little bit. Tell me about your past and your current medical conditions.
So I did have the anemia. That seems to have resolved itself. My doctors did some blood work, and it seems like that's normal now. I've had hypertension for a couple years. I'm overweight, so my doctors have counseled me on that before. And then I'm perimenopausal too.
Okay. Thank you for that information. Would you happen to know any of your family medical history?
There's been some heart problems in my family. My mom has hypertension too. She had a heart attack. My dad had a stroke. And my brother has type 2 diabetes, and my sister also has hypertension. So kind of a whole bunch going on.
Okay. Thank you for sharing that information with me. It's all very important in the whole scheme of your care, so I'll make a note of that. Next, can you tell me about the medications that you're currently taking?
Sure. I was taking an iron supplement. I take aspirin kind of whenever I have a headache, and then I'm on a Tenolol too.
Okay. Are you having any issues with those medications?
No, I haven't noticed anything.
Okay, that sounds good. What about dietary supplements? Are you taking any of those?
No, I was taking the iron. I don't know if that counts.
Thank you. Okay, so now we're kind of going to dive more into the nutrition and diet portion of the interview. Let's start by, do you use any tobacco products, or have you used any in the past?
Nope.
No. What about illicit drugs?
Nope.
Okay, and then how about alcohol?
I'll have a glass of wine sometimes.
Okay. About how often?
Maybe like 2 or 3 times a week.
Okay, thank you. Now tell me a little bit about any food allergies or intolerances that you may have.
I don't have any.
Okay, great, thank you. And then let's move on to appetite. Have you noticed any changes with your appetite, or are things kind of consistent?
I feel like my appetite's been pretty consistent. I don't really have the energy to like cook as much, but appetite's been good.
Okay. And have you experienced any nausea, vomiting, diarrhea, or constipation recently?
I get constipation occasionally,
Okay.
but that's been going on for most of my life.
Okay. Do you know for about how long that time period is that it's been happening?
Probably like 30 years-ish.
Okay. Thank you.
Mhm.
So you mentioned you're kind of too tired to prepare meals. Who does the purchasing and preparing of food in your house mainly?
It still most of the time falls to me. My husband, he'll help cook sometimes, but I usually do the food shopping.
Okay, great. And do you have any issues with that other than just kind of the fatigue you're feeling?
I'd say that's like my main symptom.
Okay.
Yeah, well, that's not true. I also have like really itchy skin. I'm not sure where that's coming from either.
Okay. And that's kind of inhibiting how you prepare and when you prepare food?
Not the itchy skin really, more the fatigue, I would say.
Okay. Now, can we talk a little bit about your weight, if that's okay with you?
Sure.
Do you know how much you currently weigh?
Not off the top of my head.
Okay. Have you kind of noticed any changes in your weight in the past?
I feel like it's been increasing kind of steadily over the past couple months, even though I don't feel like I've changed that much. Yeah.
Okay, great. Thank you. And then do you follow any special type of diet, or have you kind of done any diets in the past?
Yeah, once I found out that I was anemic, since then I've been trying to increase like the amount of iron foods that I eat, so like spinach and meat and beans and stuff like that. But other than that, just try to eat a healthy diet.
Okay, thank you. So next, can you kind of walk me through a typical day in your eating, including what you eat for breakfast, lunch, dinner, and if you have any snacks throughout the day?
Sure. For breakfast, I'll usually have some coffee with cream and sugar, and I'll have like toast with peanut butter or toast with scrambled eggs, like something easy. And then lunch, I'll pack that and I'll eat it at work. And I usually do like a spinach salad. I try to do like a grilled steak or chicken breast or something. And then I'll have like a piece of fruit or like a bag of chips, and some water, maybe iced coffee if I'm still feeling tired at that time. And then dinner, kind of depends. I've been trying to work in like more meat, so like spaghetti with meatballs or like chili, for the iron. And then I'll usually have a side salad, a spinach salad with dinner typically.
Okay, great. Thank you. And then one last question that I have for you. What kind of physical activity or any exercise do you do throughout the day?
For the past couple of months, none. I've just been too tired to even think about it.
Okay, great. Well, thank you so much for coming in today, Maria. I'm going to take all this information into consideration and then we'll make a plan that best fits you.
Thanks.
Thank you for your time.
All right, you can go ahead.
All right. Hello, Mr. Holderfield. How are you today?
Hi, I'm okay. How are you?
I'm good. I'm Victoria Mu. I'm the registered dietitian here today. Thank you for coming to see me. Is there a name you prefer to go by?
You can call me Nate. Keeps me young.
Okay, Nate. Nice to meet you. So, before we start, could you quickly confirm your full name and date of birth for me?
Yes, my name is Nathan Holderfield. My birthday is September 25th, born in 1948. I'm 73 years young.
Oh, wow. Reminds me of my dad. So, could you quickly explain why you came to see me today?
Well, I've been seeing the same doctor for about 10 years now, Dr. Martinez, great guy. I see him like every 3 months, and I don't know, at least like for me to see you today, I guess we're just gonna talk about, I don't know, my diabetes,
Mhm. All right.
stuff like that.
So you've been seeing this doctor for over 10 years. It seems like you have a great relationship with him. And you guys meet about every 3 months, you're saying?
Yeah, yeah.
Okay. So today we're just to give you a little brief overview of what we're gonna do. We're just gonna get to know you a little bit. I'm gonna ask you a few questions about yourself, what you eat, what you do. Is that okay with you?
Sounds great.
Alrighty. So, just for starters, where do you live right now?
Right now, I live in a senior apartment complex. I live alone. My wife actually passed away 7 years ago from breast cancer. So that's been a little hard, but I have 2 children who live nearby, and I do get to see them and my grandkids on a weekly basis. So that all helps.
All right, that sounds great. How many grandchildren you say you have?
I have 5.
Okay,
So
that sounds really great.
yeah, it's a lot of fun. They keep me young.
That's nice. So tell me a little bit more about what you do for work, if you do work.
I'm actually retired. It's been great. I just really stay at the apartment complex most of the time. I got my friends there. We play cards, we garden. We go to different, they call them senior enrichment activities. So fitness classes, and we
Oh,
go
wow.
on day trips. It's a lot of fun.
Okay, that sounds like a great time.
Yeah.
So you mentioned in the beginning of the conversation that you had type 2 diabetes.
Yes, that is correct.
So was there any other medical conditions that you've been diagnosed with in the past?
Yeah, it's been a lot actually, but I'm managing hypothyroidism for past 10 years or so. They say I have dyslipidemia or something like that, whatever that means. Osteoporosis as well. I actually had a fall and broke my right hip. So I had that.
Sorry to hear that.
Yeah, I had that ORIF surgery, but it's been okay. But those are the main diagnoses, I guess.
All right. So just to go over what you said really quickly, it was hyperlipidemia, which is actually high cholesterol. You know, they put it in that fancy term, but that's pretty much what it means, high cholesterol.
Sure.
You had type 2 diabetes, osteoporosis, you had that recent fall. Sorry to hear that again. And then hypothyroidism. Does that sound correct so far?
Yeah, I think you hit the nail on the head.
All right, great. So I'm assuming you're currently on medication. If so, would you mind naming some of them to me?
Yeah, so I take Fosamax for osteoporosis, Synthroid for my hypothyroidism. I take Pravastatin for the high cholesterol we were talking about. And for my diabetes, I take metformin, and I think it's like Jardiance or something like that. Some weird name, but
You got it.
yeah, I'm on like 5 medications right now.
All right. So do you take any other things with it, like supplements, vitamins, or anything like that?
Oh yeah, I do take calcium for my bones and vitamin 3
All right.
also for my bones.
Good to know. Thank you. So we're gonna move a little bit towards food now. Tell me a little bit about, usually food habits. Where do you eat? Who cooks?
Sure. I actually cook my meals for myself, believe it or not.
Great.
I have a good appetite. And I like to go out to eat with my friends and my family. I just am mainly watching my sweets because of my diabetes. So yeah.
What does watching your sweets usually mean for you?
I gotta skip on the chocolate cake every now and then. When it's the grandkids' birthdays, maybe just like a small piece of cake. But I mean, I wish I could have like 2 pieces, but I had to make these changes for my health, which is what Dr. Martinez said. So
it seems your appetite has been great. You cook for yourself, which it seems you're very proud of, and you're trying to cut down the sugar by eating a little less cake at events, having a smaller piece instead of a bigger one, or having 2 pieces.
you got it. Yeah.
All right. Do you have any allergies that you know of?
I have an allergy to fanfish. I get diarrhea and a rash.
Oh, I'm sorry to hear that.
Yeah,
Sorry, what'd you say?
I just said I just avoid that fish.
All right.
But that's
Good
it.
plan.
Yeah.
So you talk about cooking for yourself. How's your chewing and swallowing? Have you noticed any changes with that?
No, I would say I'm as healthy as a horse, really.
Nice. It's good to hear. And have you experienced any nausea, vomiting, or diarrhea or constipation lately?
Constipation, actually. So I do drink prune juice every morning to help with that, and it helps.
Okay. How long has this constipation been a thing?
Probably like 10 years with this hypothyroidism.
Oh, wow.
Yeah.
So do you happen to know anything about your current weight? If so, what would that be, if you don't mind sharing?
Yeah, I mean, I feel like I'm at a good weight. I'm 5'10". I think last time I checked, I'm like 152 pounds, but I don't know. I feel lighter. Maybe I lost like a couple pounds in the last 3 months, but
3 months.
yeah, I didn't plan to lose this weight or anything.
All right. So you usually feel like you're at a good weight, but you think the past few months you've lost a little bit?
I think that would be accurate. Yeah.
Okay. So with all the, you're cooking for yourself and things like that, have you at any point tried any diets or been on any diets before?
No, not really. I just, try to cook for myself. I try to enjoy a meal out with my friends. I mean, I just really make sure to check my blood sugar every day. So
all right.
Fancy diet, really.
All right. So let's dive in a little more about the foods you eat. Let's take yesterday, for example. What does a typical meal or snack look like for you?
Meal or snack? Well, I'll tell you about my breakfast. So I have my prune juice. I have some oatmeal with some raisins. It's probably my favorite breakfast. For lunch, I like just like a tuna fish sandwich, something easy. Um, and then for dinner, I mean, if I go out with my friends or my family, they try and talk me into a salad, but every now and then I like a steak.
Right. And that's what most days look like for you?
Yeah, for the most part. If I choose to have a dessert, I would probably just keep it at like strawberries or something like that, you know?
Sounds great. I just have one more question for you and I'm gonna let you go.
Sure.
So have you had any previous experience with dietitians or any other nutrition experience?
Yeah, actually, I attended some diabetes education classes and that helped me a lot. They told me how like reducing my sugar intake would be beneficial for my health and my type 2 diabetes. And so, yeah, they kind of taught me how to like see fruit as dessert instead of cake. So I like those classes.
That sounds great. Thank you so much for, trusting me and sharing all this information with me. We're gonna use this to help in the future.
Yeah,
Thank you.
of course. Thank you.
All right, you can go ahead whenever you're ready.
Okay. Hello, Miss Hollick. How are you doing today?
I'm doing well, thank you.
My name is Zoe Paxos. I'm a dietetic intern and I will be helping you out today. Can you please state your full name and date of birth for me?
Sure, my name is Sarah Hollick. My date of birth is 2/25/1982.
Okay, perfect. Thank you. Is it okay that I call you Miss Hollick or is there another name that you prefer?
You can call me Sarah.
Okay, great. So Dr. Nadu wanted me to speak to you about your diet. He explained that you just had a bariatric surgery and it went very well. I'd like to take the next 5 to 10 minutes to ask you some questions about your diet and medical history. I will also be taking some notes. Would that be okay with you?
Yeah, absolutely.
Okay. So what brings you in today?
Well, as you mentioned, I did just have bariatric surgery. It was, I'm recovering slowly but surely. I am having some abdominal pain, but I'm just trying to make as many adjustments as I can, as the doctor stated.
Right. Okay. So yeah, that was a major surgery. So you're having a little bit of pain with that.
Mhm.
So first, before we talk about that and your diet, let me first start off by asking you to tell me a little bit more about yourself.
Sure. So I'm married and I have children. That was a big influence in me getting the surgery. I've tried things in the past, but I just knew I needed um, a final way to really just change what was happening with me and overall just change my life. Um, so yeah, that's kind of it. I do have a job. Um, it's full time right now. I'm going to be off for a while, just recovering from this surgery. So yeah, that's me.
Okay, sounds great. So I'm glad you made the decision. It's going to help you a lot and it'll hopefully help you with your family and everything.
Mhm.
So, let now we're going to talk a little bit more about your medical history. So
Sure.
tell me a little bit about any medical problems that you had before the surgery.
Well, in the past, I was just obese and I was having a lot of issues, related to that, just, fatigue. I wasn't able to keep up with my kids. I just was unhealthy overall, despite I think some of the changes I made. And now I'm on some different medications um, for my surgery, and things like that. But yeah, that's pretty much my history a little bit.
Okay, well, it's clear that you really do care about your health, considering the fact that you did take the steps to take the surgery and you're trying to do everything you can to follow the protocol. Um, did you have any other diagnoses before?
Just morbid obesity and some associated comorbidities, but yeah, that was kind of it.
Okay. Could you explain to me a little bit about what you know about your family medical history?
Yeah, my siblings are a little bit overweight, and my parents were a little bit overweight at one point. So it is kind of in the family.
Okay, so obesity runs in the family. So it says here on your chart that you're taking acetaminophen, gabapentin, ketolorac methamine, ondansetron, pantoprazole, insulin, and heparin. Is this correct, or am I missing any?
No, that's correct.
Okay. Are you taking all the medications that your physician has prescribed, or are there any medications that that were prescribed that you're not currently taking?
No, I'm taking them, especially recovering in the hospital. I'm monitored pretty closely.
Okay, awesome. So now tell me about any dietary supplements that you take.
Well, I'm not taking anything right now. Again, just because I'm under close watch with my nurses and physicians. So yeah, nothing right now.
Okay, and did you take any supplements in the past before your surgery?
I would take like a multivitamin, like a one a day type deal.
Okay. Okay. Are you currently using or have you used any tobacco products in the past?
No.
Okay. Do you use any illicit or street drugs?
No.
Okay. Tell me about what your usual alcohol intake was like before this surgery.
I'd maybe have a glass of wine or two throughout the week, so only like one or two per week, just with dinner.
Okay.
Mm-hmm.
Can you tell me about any food allergies or intolerances that you have?
None.
Okay, nice. Okay, I understand that you just had surgery and are currently on a clear liquid diet. Can you tell me about your appetite, any symptoms of abdominal cramping, nausea, vomiting, diarrhea, or constipation that you might be having?
Yeah, sure. Yeah, so I am on the clear liquid diet. I think it's about 2 ounces or so per hour. Um, I'm not really feeling too hungry at this point. I think I'm just, my body just went under this huge change and this huge surgery. So, yeah, I don't really have an appetite. I'm more just, sipping on these liquids to get things going and, of course, to do what the doctor says so everything heals properly.
Right, definitely is a huge change. So it makes sense that you're feeling this way. You're not too hungry, you're not as hungry as normal. Do you have any tooth loss, mouth pain, or dry mouth?
No.
Okay. Would it be okay if we talked a little bit about your weight?
Yeah, sure.
Okay. Do you know how much you currently weigh?
Not off the top of my head.
Okay.
Mhm.
Don't know.
Somewhere.
Okay. Have you noticed any changes in your weight recently?
Yeah, I think I gained a bit of weight before my surgery. I want to say like 20 pounds or so.
Okay. So you gained weight before the surgery. Now, why don't you tell me about any specific diets that you followed in the past?
Sure. So, obviously being overweight and having those discussions with my doctor, I did try implementing more fruits and vegetables in my diet, following some plans I've seen on the internet. But it just became hard for me between work and, feeding my kids. They eat a lot of like snacks and fun foods, and I was just easily tempted. So it didn't really stick with me. I could do the diets for about a week or so, and then by the time the weekend came, I would just fall off.
Okay, that's understandable. So tell me about any limitations besides what you just mentioned related to being able to purchase or prepare food.
So I don't really have many limitations purchasing food. My husband and I kind of are able to both go grocery shopping if needed. But I think going under this surgery and recovering, I think I'm just really ready to make those changes. Like I know a change will come now. And it's really given me that big boost. So I think I'm really just ready to to make this change and to prepare the foods that I need to prepare.
Oh, that's awesome. It seems like you're definitely ready to go and make some healthy changes.
Mhm.
Now, before you think about changes, why don't you just walk me through a typical day of eating, what that looks like for you before the surgery, real quick?
Sure. So breakfast was kind of on the run. So I would usually just like grab a granola bar, maybe something else, a little snack of some kind. And then by lunch, I'd be starving. And my coworkers always love to go to like this burger place down the street. So I would usually get like a burger and fries and a soda because I would be so hungry. And then by the time I get home, I'm exhausted. My kids are home, so I have to feed them. We would usually have like pizza or pasta, things like that, and then usually have some kind of dessert as well.
Okay. So how big would a normal bowl of pasta be on a normal night for dinner?
Probably like a cereal bowl.
Okay.
Mhm.
All right. So who normally prepares these meals?
Usually it's either me or my husband. Most of the time it's me.
Okay. And real quick, can you tell me a little bit about your physical activity or exercise level before surgery?
So I didn't really exercise as much as I wanted to. I walk around now and again during work, but otherwise I don't really do any like purposeful exercise.
Okay. And last question before I let you go.
Sure.
So what do you know about diet progression and supplementation after bariatric surgery?
I was consulted on it a bit.
Good question, Zoe, but I'm going to stop you there.
Okay.
What was your last question anyway?
Yeah.
But we're not going to hear Sarah's response. That's okay. Great job. I thought you guys did great. How'd you feel?
I think it went better for me than I expected, to be honest. I was like really nervous with all the questions. I was like, oh my God.
Yeah. And I mean, like you would normally, when you guys will see, for classes, we've got to get this like thorough that you can ask all the questions, but you're probably never going to be in a setting where you like ask all the questions.
Mm-hmm.
You're inpatient. You're never going to have time to like ask every single one of these questions. You're going to ask the ones that make sense for the case with the time that you have. But when you're up to seeing 12 patients a day, like you can't spend, and you've got to do nutrition education on top of the interview, you can't spend an hour with everybody. I was thinking the way you guys are asking about weight, is there another way that we can ask it? Because a lot of you are saying, is it okay if I ask you a little bit about your weight? And I'm just wondering, with all of the like weight stigma and trying to be more sensitive, I guess if I was someone at a doctor's office and I was overweight or had obesity, and they said, is it okay if we talk a little bit about your weight? I don't know if I might go immediately on the defensive.
I was thinking that too, just because like, I mean, obviously I'm playing this patient, but like someone who just went through a weight loss surgery,
Mm-hmm.
I think it's like sensitive, you know what I mean? Like I couldn't do it on my own and I had to get surgery. I mean, everyone's attitude is different, but I don't know. I thought that too, like even when Zoe was like, oh, can I ask you about your weight? I was kind of like, I don't know, like I just like felt weird about it.
Yeah. And that's how we're used to being taught how to ask it, and everybody asked it that way. I'm wondering if there's just a sentence we can say even before that. So something like, as part of me getting a full picture of your health, it will help me to understand any weight changes that you've had. And it would depend on your case versus somebody else's case. But if there's just a sentence we can say before, this has nothing to do with your rubric or your grade. This is just me talking to you guys. Don't worry about it.
I mean, it's interesting that you like bring it up, because I mean, at the doctor's office, they're not just going to be like, oh, can I ask you about your weight? It's like, how much do you weigh?
Yes.
Like, right. Like, I think I think we care so much more also because like we are still students and like, I mean, and like we said, like these are all like cases, but we're all still like
Yeah,
not those people in the
right, right.
so.
And I just like believe when I was, in the mid 90s in school, we didn't talk really at all about weight stigma and bias. I mean, that wasn't even, you all are going to be, much better ready to tackle all of that. But anyway, I was just playing with my head, like what's in any scenario, just a more sensitive way we can ask it, by just giving a brief explanation before. We don't have to tiptoe around it, but more, I'm just trying to get a full view, a real full understanding of your whole health picture. So then that frames it that I'm not just asking you about your weight to ask you about your weight. It's this piece of wanting to understand your full health picture, you as a full person might be, and then get into weight changes and things like that. And then it gives you too, I feel like, this extra moment to pick up on the patient's nonverbals. If you can tell that they're kind of, coiling or putting their arms around, or you can just tell by their face that this is going to be a sensitive issue for them. Anyway, just food for thought. I was just putting a weight stigma question on the quiz earlier, so that's what got me thinking about it. So hint, hint, I'm going to be putting a review sheet anyway in the module, but yeah, but great job. I feel like yeah, just the flow, and then you guys are getting better with your transition statements between things. It doesn't feel as wobbly. Good.
Real quick, do you mean to still be recording? I'm just curious.
Oh no.
Oh,
I don't. So I can